toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kendra Titley and I will be your moderator. Je m'appelle Kendra Titley et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Councillor Keith Eglai, Chair, Ottawa Public Health Board, the Conseiller Keith Eglai, Président du Conseil de santé d'Ottawa, followed by Dr. Brent Mallockney, Deputy Medical Officer of Health, Médecin Adjoint en Santé Publique, and Anthony Demonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Councillor Keith Eglai.
Thank you very much, and good morning, everyone. Bonjour, Kwe. I'd like to thank everyone who's participating in today's media availability, either on the Zoom call or watching through our YouTube live stream. I know many people continue to be anxious about accessing their second dose of COVID-19 vaccine or booking a second dose appointment for a parent or a grandparent. Dr. Mlockney Mr. Demonte will speak to the latest recommendations on second doses and the anticipated increase in vaccine availability. For those who have not yet booked a first dose, we continue to encourage them to do so as soon as possible in order to start your vaccine series. Our overall objective is to get as many people as possible fully vaccinated in the next several weeks. That means both first and second doses in order to protect against the variants of concern. In the meantime, we continue to encourage residents to get out, enjoy the beautiful weather and outdoor amenities. We know this is beneficial to both our physical and our mental well-being. We only ask that you do so safely, avoid crowded areas, wear a mask, where physical distancing may be difficult, stay home if you are sick, and if you're experiencing symptoms of COVID-19, please get tested. I also want to take this opportunity to wish everyone a happy Father's Day. With the province's recent move to step one of its reopening plan, we can now have small outdoor celebrations. Just keep the number of people attending to no more than 10. This means that people from different households can celebrate Father's Day together this year. Just remember to do it outdoors. Keep 2 meters apart, wear masks if you can't maintain distance, and wash your hands frequently. Thank you, and I'm going to turn it over to Dr. Mlockney.
Good morning. Bonjour. Kwe. Current COVID-19 monitoring indicators tell us that outbreaks, hospitalizations, and the number of people testing positive for COVID continue to decline. This is good news. That said, the COVID-19 wastewater viral signal is going up, suggesting more transmission of COVID-19 in our city. And fewer people are getting tested for COVID. Therefore, the reported number of infections continues to be an underestimate of the number of infections in the community. Many people can be asymptomatic or have not been tested with mild illness. Additionally, the level of transmission in the community is much higher than it was last summer, and we are now contending with more transmissible COVID variants compared with the original virus last year. We will need to reach higher levels of immunization with 2 doses before we can rely on vaccines alone to keep COVID at a low manageable level, and this will not happen until closer to the end of the summer at the earliest. This summer, how much the level of COVID-19 rises in the community depends directly on our collective actions. Cet été, la hausse du niveau de la COVID-19 dans notre communauté dépend directement de nos gestes collectifs. We can soon expect further guidance at the federal and provincial levels for people at different stages of the vaccination series. For now, our advice is the same for everyone, regardless of vaccine status. Continue to maintain a distance from those outside your household, wear a mask when you can't maintain distance, choose lower risk activities, stick with outdoors when gathering with others, and avoid crowded places. And I would like to remind everyone to continue daily screening of COVID-19 and seek testing if you or your child experiences any COVID symptoms. Je vous encourage de continuer le dépistage quotidien pour la COVID-19 et d'aller vous faire dépister à une clinique si vous ou votre enfant ressentez des symptômes de la COVID-19. Even if you're working from home, and even though children are no longer in school, this is especially important since day camps are now permitted and children will be mixing with others outside the home. Visit our website to find out how, when, and where you should get tested. Yesterday, the National Advisory Committee on Immunization, or NACI, updated its recommendations for those who received AstraZeneca for their first dose. In this scenario, NACI states that a second dose with an mRNA vaccine, Moderna or Pfizer, is now preferred based on emerging evidence of a potentially better immune response from this mixed vaccine schedule and to mitigate the potential risk of rare but severe blood clots associated with AstraZeneca. Either Moderna or Pfizer are safe options for a second dose if you received AstraZeneca first. Now, for those who received AstraZeneca for both doses, you can rest assured that the vaccine provides good protection against infection and very good protection against severe disease and hospitalization. You do not need to receive another vaccine, and you are now considered fully immunized. Now, if you received an mRNA vaccine for your first dose, so either Moderna or Pfizer, it's recommended that you receive the same vaccine for your second dose if it's readily available. However, if the same mRNA vaccine is not readily available, NACI states another mRNA vaccine is considered interchangeable and should be used to complete the vaccination series. So, if you received Pfizer for your first dose, you can get Moderna for your second dose and vice versa, and it is safe to do so. Both Moderna and Pfizer rely on the same scientific approach to protect against COVID-19 infection. They have very similar effectiveness and side effect profiles. Moderna et Pfizer utilisent la même approche scientifique pour protéger contre la COVID-19. Ils ont une efficacité et des profils d'effets secondaires très similaires. Vaccine interchangeability is not a new concept. Getting the same vaccine for the first and second dose or an interchangeable schedule are both considered valid options, and both will count as a completed series. Earlier, I mentioned that our behaviors directly impact COVID numbers, and while we can expect an increase in COVID indicators as we move into step one, it doesn't have to be significant if we keep up with public health measures in place. For students, it's probably been the most difficult and challenging year you've ever had in school. As you approach the end of the school year, it's time to celebrate everything you accomplished and enjoy time with your friends. You can still do so while still doing your part to help reduce the spread of COVID-19. Keep gatherings outdoors. Enjoy that bonfire, pool party, or beach day, but limit your contacts. The current limit to outdoor gatherings is 10 people, and try to keep it to the same people. I know it's hard and you want to hug your friends, but it's best to maintain a distance of at least 2 meters for now. Always bring a mask with you in case you can't maintain a distance from others, and bring your own drinks and snacks and don't share them with others. If everyone does their part, by getting vaccinated as soon as they can and maintaining public health measures, I am hopeful that we can all enjoy a safer, happier summer. Si tout le monde fait sa part en se faisant vacciner le plus tôt possible et en observant les mesures de santé publique, j'espère que nous pourrons tous profiter d'un été plus sécuritaire et plus heureux. Thank you. Merci, Miigwech.
Thank you, Dr. Malakmi. We'll now hear remarks from Mr. Demonte.
Good morning. Bonjour. We continue to use the vaccine supply allocated to Ottawa and are making significant progress in vaccinating our community. When combined with pharmacies, primary care, and other channels, over 90,000 Ottawa residents received the vaccine last week alone. This is a testament to our collective resolve to protect one another against COVID-19. Plus de 90 000 résidents d'Ottawa ont reçu un vaccin la semaine dernière seulement. Ceci témoigne de notre détermination collective à se protéger l'un des autres contre la COVID-19. To date, nearly 820,000 total doses have been administered in Ottawa, and 75% of adults have received at least one dose. Now, with more vaccines on the way, we are prepared to ramp up our operations. We are receiving 27,000 doses of Moderna today, with an additional 25,000 that are being sent to local pharmacies. Combined, these 52,000 doses represent the first allocation to Ottawa of over 9 million Moderna doses the federal government has announced it expects to receive through the end of June. Further, in addition to the 5,000 doses provided to the city last week, the province has confirmed we will receive another strategic allocation of 33,500 doses of Moderna tomorrow, bringing the total to 38,500 additional doses over the past 2 weeks. En plus de 5 000 doses fournies à la Ville la semaine dernière, la province a confirmé que nous recevrons une autre allocation stratégique de 33 500 doses de Moderna demain. Ceci porte le total à 38 500 doses supplémentaires au cours des 2 dernières semaines. This reflects what staff have consistently requested from the province and what was recently supported publicly by Mayor Watson. Regular deliveries of Pfizer also continue, and some AstraZeneca is available in selected pharmacies and primary care settings. With more supply, we can publish additional appointments in the system and open more community clinics. Avec un approvisionnement plus important, nous pouvons publier les rendez-vous supplémentaires dans le système et ouvrir de plus de cliniques communautaires. Next week, we will open additional clinics at the Canadian Tire Centre, University of Ottawa, Nepean Sportsplex Curling Rink, the Horticultural Building, and Canterbury Recreational Complex. In all, these 5 clinics will nearly double the total number of clinics in Ottawa from 6 to 11, with a combined capacity to administer up to 100,000 doses per week. Expanding operations to this extent would not be possible without unprecedented support from our community partners, including the Ottawa Hospital, CHEO, the Queensway Carleton Hospital, Kids Come First, the University of Ottawa, and the Canadian Tire Centre, amongst many others. All these groups are contributing in different ways to the success of our vaccine rollout, and we sincerely thank them for their continued support and leadership. Ces groupes contribuent de différentes façons au succès de notre déploiement de vaccins. Nous les remercions de leur appui et de leur leadership continu. There are currently appointments available in the provincial system. As always, demand in Ottawa is significant. If you encounter any issues, I encourage you to check back in the system from time to time, as newly available appointments are continually appearing due to cancellations and scheduling changes. More appointments will also become available in our community clinics as additional supply is confirmed by the province. It is also important to remember that you do not need to wait for an appointment in a community clinic. Eligible residents looking for a first or second dose appointment are encouraged to continue to contact primary care provider or a pharmacy. Les résidents admissibles qui cherchent à obtenir une première ou deuxième dose sont invités à communiquer avec une pharmacie ou un fournisseur de soins primaires participant. Every dose administered brings us closer to community immunity. Please remain patient and know that every day thousands of people are being vaccinated. With every dose administered, we're getting closer to reopening our city. Last weekend, we were pleased to see many people enjoying the activities permitted under Step 1 of the provincial reopening plan. A few reminders ahead of this weekend. For those in line at a patio, please remain at least 2 meters distance from anyone outside your household and wear a mask. Limit your gatherings in parks and beaches up to 10 or less, and remember that smoking, vaping, or alcohol are strictly prohibited. Lorsque vous faites la queue dans une terrasse, veuillez maintenir une distance physique de 2 mètres de distance à quiconque à l'extérieur de votre foyer ou portez un masque. Limitez vos rassemblements dans les parcs et les plages à moins de 10 personnes et n'oubliez pas que fumer, vaporiser et boire de l'alcool sont strictement interdits. As always, bylaw and regulatory services and Ottawa Police will continue to monitor for compliance. Our team has proven time and time again, once more vaccines become available, we are ready to ramp up quickly and adapt our operations on vaccine supply from the province. The best way to get more accurate and up-to-date information about our vaccine rollout in Ottawa is through the City and Ottawa Public Health. You can find the information at ottawa.ca and at ottawapublichealth.ca, or follow us on our social media channels. Thank you very much. Merci beaucoup.
Thank you, Mr. Demonte. I will now invite questions from each agency alphabetically. You may ask one question with a follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with Ryan Jones at CBC Ottawa.
Hi there. This question is for Dr. Malukny. Just wondering, so Ottawa's not on the list of Delta variant hotspots. So can you just give us an update in terms of where we are at in terms of the spread of the Delta variant in Ottawa? How much of a concern is it? How are we measuring it? And will it become the dominant strain at some point?
Right. So for the Delta variant, and just to back up for a second, so we've had a series of variants. The situation that we had with the last resurgence, we saw an increase of what's now called the Alpha variant, which was first identified in the UK, more transmissible than the original virus that we would have had last year, probably 40 or 50% more transmissible. And with that advantage, it had become and is still the dominant variant that we have here in Ottawa. The way it gets transmitted doesn't change, but it is just more transmissible. So if you give it the opportunity, there's more a chance that you're going to become infected if you're susceptible. The Delta variant, which was first identified in India, has different mutations, and it allows it to be even more transmissible than the Alpha variant. And so that's one of the concerns is that it's a lot more transmissible than the Alpha variant, and therefore way more transmissible than what we would have been experiencing last summer. So that's the first piece. The other concern with the Delta variant is that for people with only one dose, it provides less protection against the Delta variant. And so this is one of the reasons why we are pleased that the second dose scheduling and the availability of vaccines is really important. Because one of the ways to deal with the Delta variant is to get as many people to have 2 doses of vaccine as soon as possible. The other way to buy us time, because this variant, because it has more transmissibility, it will likely become the dominant virus here, just as it has already done in England, is to prevent transmission. Because the more opportunities for transmission there are in our community, the more opportunity there will be for the Delta variant to spread. So far, there's not much Delta variant here, and we want to keep it that way. And so that's twofold. One, we have to continue to do public health measures and reduce the risk of transmission. And 2, we need people to be vaccinated and to do it as soon as possible.
Ryan, do you have a follow-up?
Yeah, sure. This question is for Mr. Demonte. This week, we saw some sniping between the mayor and the province about the amount of vaccine doses that Ottawa was receiving. We had the mayor asking for more, and then the province saying there were thousands of doses in freezers. Can you just elaborate a bit about what all that was about, and if you think the disagreement has now been settled with these new deliveries?
Yeah, so I'll tell you what, I'm always a person, my focus is on getting needles in arms, and I won't talk about the politics of it, but let me try to perhaps clarify, and I appreciate you asking the question. So we're running a 7-day-a-week operation, and when we receive vaccine, it's all planned and managed to be able to put into arms as quickly as possible. And I'll give you the example I know that was cited was, on the Sunday of that week, we had 23,000 vaccines in our fridges, as I was described. We receive our vaccine every week on Monday. So let me give you the example here so it can be as clear to understand how this operational tempo works. So on Sunday, we need about 12,000 vaccines for the Sunday. So that's part of that 23. And then Monday, we have also people who are coming to get their vaccine. We need another 12,000 to do that day. Normally, we receive our vaccines. We get about 53,000 Pfizer. That's what we've been having historically, over and above what we're getting this week, which is great. But so we get that on Monday somewhere just a little bit before noon. So Mrs. Jones that's coming in the morning to get her vaccine, we need that vaccine. So that's what that other 12,000 is for the day. When we receive the vaccine, it arrives frozen, and we have to do processes. We then distribute it. So that vaccine that we receive on Monday can't be used on Monday. It's only used on Tuesday. So that's what this 23,000 is on Sunday. It's a moment in time. There's no vaccine hidden in fridges or maintained. And I'll just give you an example. That same weekend, I'll give you examples of other public health units that have very similar operations as us 7 days a week. In York Region, there were 43,000 vaccines on the Sunday in their freezers. Peel had 50,000, and Toronto had 114,000. So it's all very normal if you take a moment in time. And as a matter of fact, today we'll be receiving 25,000 Moderna. If you would look at today's numbers, we'll have 25,000. So I just want to reassure people, there's nothing held in fridges. It's just part of the operational tempo. It's very normal. I don't know if people are getting confused or if the back and forth between elected officials is something else, and I don't want to comment on that. I think what's really important to the community is know that when we get vaccine, we put those appointments in the system. You book on them, and as I mentioned previously, we have some 200,000 appointments currently in the system for people up until July 6th. Well, when Mr. Jones is coming next Thursday, those 200,000 vaccines are already accounted for, and they're waiting for them. So our commitment has always been, when you arrive, your vaccine is there. And I think that's what people want to have an assurance. So I just want to reiterate that. And with regards to the back and forth, just finally, as I said, we did get the strategic allocation that we had asked for, and that the mayor also was publicly going back and forth with the province. And I'm very pleased, because that allows us today to publish 60,000 more appointments in the system for the new groups that are coming forward. So this is very good news for our community. And again, be reassured, when we have vaccine, it's posted and it'll be waiting for you when you arrive.
Yeah, Ryan, as the elected official on the panel today, I appreciate Tony doesn't want to talk about politics. Neither do I, really. What I want to focus on is, as Tony indicated, we've got significant supply coming in. We're going to nearly double the number of community clinics. So our focus now, I think, is on the way forward. It's a positive way forward. We have supply, we have clinics set up, we have people booking as we speak, and that's where we want to go. Tony was quite right when he said his goal is to get as many jabs in people's arms as possible, as quickly as possible. That's what we want to do. That's what we need to do. As Dr. Malachny said, this is a race against the variant, and we're on the right track right now. And that's what we need to focus on. Supply is there, clinics are there, booking capacity is there. Let's just do it.
En français, s'il vous plaît, Monsieur Dimonté.
Oui, bonjour. Essentiellement, c'est des nouvelles positives qui, pour les prochaines semaines, on reçoit de plus en plus de vaccins, et donc on rouvre plus en plus de capacité dans le système, et c'est notre objectif. En fait, la discussion qui avait eu lieu, qu'on avait 23 000 vaccins dans nos réfrigérateurs, juste pour vous expliquer un peu le processus, on a une opération qui fonctionne 7 jours semaine, et dont dimanche, on a besoin pour cette journée-là, pour les gens qui ont déjà leur rendez-vous, 12 000 vaccins pour cette journée-là. Et lundi, on a aussi besoin de 12 000 vaccins pour le lundi. Donc, c'est pour ça qu'on a 23 000 vaccins le dimanche, quand on regarde cette journée-là. On reçoit nos vaccins normalement les lundis vers les midis, mais ces vaccins-là sont congelés et doivent suivre un processus de contrôle de qualité et par la suite être distribués. Donc, sont seulement utilisés le mardi. C'est pour ça que le dimanche, quand on regarde le dimanche, on a le double normalement de vaccins, parce qu'on a le double de personnes qui vont venir le dimanche et le lundi pour être vaccinées. Donc, il faut avoir les vaccins disponibles. Et juste pour vous donner un exemple, on est une opération 7 jours semaine, nous, d'autres groupes de santé publique dans la province, la même journée, donc on cite qu'on avait 23 000, la municipalité régionale de York avait 43 000 dans le réfrigérateur, la région de Peel avait 50 000 et la région de Toronto avait 114 000. C'est très normal parce qu'eux aussi font la même chose, parce que dimanche et le lundi, on doit vacciner les gens et par la suite, on reçoit. Donc, c'est un processus 7 jours semaine. Je pense qu'on fait de tout ça une complexité, qu'il n'y a pas de complexité à avoir. C'est un processus opérationnel qui est normal pour la distribution des vaccins. Je veux juste terminer en disant que je suis très content qu'on reçoit des vaccins supplémentaires. Aujourd'hui, on va recevoir 25 000 Moderna et par la suite d'autres vaccins en fin de semaine également. Donc, c'est super positif et dans ce sens-là, on rouvre d'autres centres et notre mission et notre objectif demeurent clairs, de donner des vaccins aux gens le plus rapidement possible. Et je veux rassurer les gens, s'ils ont un appointement, le vaccin va être là pour eux lorsqu'ils arrivent par notre processus de gestion de notre vaccin. Merci.
Thank you. We'll now go to Eric O'Brien at City News Ottawa.
Hi, my question is for Mr. DeMonte. What's the rate of no-shows for vaccine appointments in Ottawa, and what's the city doing to ensure that those doses don't go to waste?
So twofold, we have seen a bit of an increase, and we're told there is not a glitch. The provincial system, for instance, if you book today in the system to advance your second dose, you had an appointment, it'll only be eliminated in 4 days. So there's a process there that creates a bit of a no-show. So we're seeing more of that. I don't have the exact number. It's not significant, but it does seem to be increasing. So we are keeping a very close eye on that. I want to reassure you that there's no loss. Again, it's kind of, the operations I just talked about, the way we run our operations, the same thing, the clinical staff and the staff that are in the clinics only thaw out and prepare vaccines a little bit ahead of time. So if there are, 100 no-shows in a clinic at the end of the day, those 100 vaccines aren't lost because they're not thought out and they're not prepared or diluted, and they'll be ready for the next day. But we have a process in place, led by our public health and the prioritization team that follow the provincial orders. At the end of the day, we have a list of priority groups, often priority healthcare workers, et cetera, that we're able to use those 100 doses often with them. And if those don't get used, those doses are still good for the next day. There's no issue. So we haven't seen any problem with loss. That said, your point is well taken. We're monitoring that closely because that seems to be something that we're seeing more and more. But to date, there has been no loss and no process that the process is put in place assure that.
Thank you. Now, my follow-up question is about the 38,500 doses arriving. You said that it's going to help address some of the existing demand here in the city. But now, as of Monday, all 18-year-olds that got their first shot before May 9th can book their second dose. So will it be enough?
Well, directly, the numbers, the answer is no. Clearly, it's not enough. That cohort, when one looks at it generally for first doses, those that are available from May 19th to April 19th to May 9th, there's 155,000 people in that cohort broadly. We're adding another additional 60,000, which is a very, very positive move forward. I just want to also point out, you can see, and we said this since the beginning, when we get more vaccine and we're going to have more demand, we're ready to ramp up, and that's what we're doing Monday by having these additional sites open up, because our confidence level in our discussions with the province is that we feel that in the next few weeks we're going to continue to see this additional Moderna arriving over and above what we're regularly getting with the Pfizer and those 200,000 appointments that are in the system. The Pfizer and what we have already planned will take care of that, but this is over and above, so that's why we're opening up, the Canadian Tire Center, the University of Ottawa, and those other sites, because we're confident that we'll be seeing this this additional arrival on a more regular basis in the coming weeks. It hasn't been confirmed for us, yet, but that's why we've mobilized those sites, because we're in good stead. So those 155,000, while they may not all get in obviously this week because we only have 60,000 additional, I think in the coming weeks we'll be able to make great strides and knock away in that group as well too. So I'm very positive today with regards to what's coming.
Thank you.
Thanks, Eric. Next, we have Josh Pringle at CTV Ottawa.
Good afternoon. My first question is for Mr. DeMonte. The good news, obviously, Ottawa is getting more vaccines. Has there been any impact in the operation because these doses haven't arrived since the mayor first asked 2 weeks ago? And has it been a setback in the vaccine rollout that you haven't had as many vaccines as the city has dubbed a fair share?
Not recently, and two reasons for that, Josh. First, as we've always said, if you have an appointment in the system, it's because we have confirmation from the province that that vaccine supply is arriving. So we only put what's in there. And then we've told people, please be reassured, when you arrive, your vaccine will be waiting for you. So we've been really focused to ensure that, because at the end of the day, that's what's important to people, that they've got their appointment, they know what's there, and when they arrive, they don't have to cancel. I don't know if you remember, but historically, we did have challenges in March. I remember March 25th, we were supposed to receive our supply, and we didn't get it till March 28th. So quite a few people had to have canceled appointments. And then in the week of March 22nd, we were supposed to get our supply. We didn't get it till April 7th. So all those appointments had to be canceled. Twofold on that. Now we're seeing to get a regular supply on a regular basis. And by our processes and our operations that we put in place and the guarantees that we have, that hasn't happened. And so directly to your question, we haven't seen that recently, fortunately, because of the processes we have in place. We haven't done anything. We've been much more conservative. We only publish what we know is confirmed that we're receiving, not what's supposed to be coming. And that allows us to ensure the community that when you arrive, you will have a vaccine.
My second question is more of the political answer, so I'm not sure if Mr. Eglai wants to answer, or even Dr. Malakny. What do you say to people when they look at the different vaccination rates across the province and they see only 12% of Ottawa adults have both doses, but it's 20% in Toronto and those regions? Like, what do you say to people who are maybe frustrated that they're waiting longer for their second dose?
Well, I'll start off and then I'll let Dr. Malakny jump in. I mean, one of the things we have to keep in mind, I'm sure it's frustrating for people. I have no doubt about that. But, we're in the middle of a province-wide, a country-wide, a worldwide situation. And Dr. Malakny can speak to this, but what he's likely to say, and I don't want to put words in his mouth, is that we do have hotspots in the province still. Ottawa, luckily, is not one of those hotspots. And the province has made a decision to put more resources in areas that are hotspots. We're all one big community, so people move around, business moves around. So I think that's part of the rationale behind it. And while I do, as I say, understand people's frustration, as Mr. DeMonte said, we're in good stead right now. We have a significant amount of doses coming in today. We have continued promises that we're going to receive doses at an accelerated rate over the next little while. We're almost doubling our clinic capacity. So that's all going to help to ease that frustration. But I'll turn it over to Dr. Malakny. But I think part of the issue is where the hotspots are and how we're all kind of interconnected within the province and the country, and the need to stamp out the variant as quickly as we can.
Yeah, no, Chair, great points. And I agree. I mean, I think that we are all interconnected, and it's to the benefit of all of us if the areas where there's more Delta variant, that additional efforts go there to try and contain that. At the same time, I mean, we've got lots of demand here in Ottawa. Demand has always been higher than supply, and in some ways that's a good problem to have. But it's great news that we're getting substantially more doses coming in now, and more appointments will be opening up. So both are important. It's important to recognize that we're connected, that there is additional effort for the hotspots, while at the same time we're getting more doses to improve our coverage rates.
Thank you very much. We'll now go to Craig Lord at Global Ottawa.
Thank you. I'll go to Tony DeMonte first. Just looking for clarification on the 33,500. I think you said in your comments, are those all Moderna, and are they coming tomorrow, did you say?
Yeah, so excuse me, the additional, so first arrival of 27,000 at Moderna today, and then another 25,000 are going to local pharmacies. And then we're going to get another 38,500 additional as well as part of the strategic supply as well on the weekend, we're being told. So yes, and that's all Moderna.
Okay, and I don't know if this is to you or maybe to Dr. Malakny, but as we are seeing this surge of Moderna coming into Ottawa, and specifically the community clinics, the NACI guidelines are saying, you know, if you get one mRNA, it's preferred to have the same one as your second, but they are, if not available, interchangeable. So is the allocation going to focus on giving first dose Moderna, second dose Moderna, or when you're booking at a community clinic, is it if you got like agnostic of what you got first, you get what you get?
Maybe I'll start, you know, from a public health medicine perspective, and then turn it over to Tony from an operational perspective. So for the NACI guidelines, so for the people who had an mRNA vaccine for their first dose, whether Moderna or Pfizer, what it says is that if, you know, when you go to the doctor's office or the pharmacy or one of our community clinics, you know, if they have the same mRNA and it's readily available, then go with that. But if not, it's perfectly acceptable and in fact strongly recommended to proceed with your second dose mRNA of the other brand. These things are interchangeable. They're the same effectiveness, same side effects. You know, would not want people to you know, walk away. The recommendation would be you take whatever mRNA vaccine that is available that day.
And maybe I'll answer on the operational side. So certainly it does become tricky. I guess for, you know, to illustrate, initially we were just getting a very large amounts of Pfizer. That was our, you know, so we were a Pfizer community, for lack of a better term. And now while that continues, we seem to be getting much more Moderna. The operations team is managing that. As I said, we're still getting our regular Pfizer allocation, so that'll still be coming in. And now with the additional Moderna, what we're attempting to do is distribute, you know, throughout all the clinics. So when you book online, you'll be booking, but when you arrive, we'll try to have both options for you. I think eventually the math won't work out. So the as Dr. Malakny just mentioned, you'll be asked probably to take, it'll be informed consent, but you'll be asked to take the mRNA that's available to you. But we are trying to make efforts to balance that out. I think it's going to be a challenge across the province. It's just the way that the flow and the supply has been arriving and what will arrive. So for instance, you know, we're getting our regular Pfizer allotment on Monday of 53,000, and we know a lot of our appointments are already booked for that. And then we're getting what I just described to you, the Moderna on the weekend, and that's added to these new clinics. So we're going to try to distribute that, and hopefully the clinicians at the site with each individual that's coming to get vaccinated will have some informed consent and be able to do that. But I'm convinced, as Dr. Malakny said, we will at one point, and maybe sooner than later, people will have to make that informed consent and say, well, currently we only have this product, this mRNA, even though you have the other one. And I would hope that people would understand and would take that mRNA. The science is clear. Dr. Malakny's told you, NACI's now confirmed that as well too. So please get that dose. Let's not defer. If you're arriving and there's an mRNA and it's not the one you really got, you should take the one that's in front of you.
Thank you very much.
Next, we'll go to Elizabeth Payne at the Ottawa Citizen.
Thanks for taking my question. I think this is for Dr. Malakny. It's about AstraZeneca. I think more than 70,000 Ottawa residents received AstraZeneca as a first dose, and some of those, I understand, did so because they're allergic or potentially have health issues with mRNA vaccines. I know, I wanted to know sort of, is there any AstraZeneca in town, and what are you saying to people who need one for a second dose?
So, I mean, my understanding is actually we received AstraZeneca into the city, and I'll turn over to Tony after I finish my answering your second question just to confirm that. But I mean, when you look at the recommendations from NACI, certainly they do flag that if there's anaphylaxis against an mRNA vaccine, so in other words, you had an mRNA and you had a reaction to that, or to one of the components. So that should be actually a very, very small number of people. I mean, that's a conversation between that person and their healthcare provider, plus or minus perhaps a specialist consult. But if for those people who have a contraindication against an mRNA vaccine, then an AstraZeneca as their second dose would be a good choice. And as far as I know, we're still been receiving. Tony, can you confirm that?
Yes, Elizabeth, we will. There will be enough AstraZeneca for those cases that Dr. Malotny just described and that you bring up. We are receiving some as well in Ottawa, so that capacity will exist within the system.
Okay, and for a follow-up, maybe Mr. DeMonte, do you have any idea what size of cases that is? And a very specific question. Someone I've spoken to was told she would have to go to Charlotte Lake, for example, because there was none in town. So there seems to be a miscommunication going on.
Yeah, no, I feel for that individual. No, so I don't think people have to go to Charlotte Lake. For those individuals, the pharmacy chains will be receiving, and some of the primary care groups as well too will be seeing. We'll have enough AstraZeneca to deal with all these cases. I don't have the exact number. I'd like to be able to tell you that, but I'm hearing it's a significant number nonetheless. So I don't think we'll have any trouble if the vast majority of AstraZeneca users transition over to mRNA because they don't have issues with anaphylaxis as has just been described. Those that do, there'll be more than enough for them to get their second dose.
Okay, thanks.
Thank you. On va maintenant à Antoine Trépanier, Radio-Canada.
Oui, désolé, mon micro avait de la difficulté. Ma question est pour M. Desmonte et M. Iglay, peut-être pour une réponse politique. Concernant les no-shows, on parle dans les dernières semaines entre 300 400 rendez-vous qui ont été classés comme no-show dans les cliniques communautaires. Je sais, M. Desmonte, vous avez dit un petit peu plus tôt dans le point de presse que vous suiviez ça attentivement, mais quelles mesures précises est-ce que la Ville peut mettre de l'avant pour éviter ces no-shows-là, puis éviter aussi la frustration chez les résidents qui veulent se faire vacciner, qui passent des heures sur le système pour avoir leur rendez-vous? Qu'est-ce que vous leur dites? Et qu'est-ce que vous faites aussi pour pallier à ce problème-là?
Mais essentiellement, la problématique est une de technologie qui appartient à la province et on suit de près pour assurer qu'il n'y a pas d'impact au niveau des opérations. Ça dit, nos collègues à la province sont très au courant de la problématique. C'est pas seulement à Ottawa, je peux vous dire ça, c'est à travers la province. Donc, ils travaillent de façon acharnée à régler le problème parce que si ça continue à grandir, vous êtes en train de poser la problématique dans votre question, ça peut devenir de plus en plus problématique. Pour l'instant, il n'y a pas vraiment d'impact majeur sur nos opérations. Et je vous dirais aussi, bien que la frustration des gens là, qui ne peuvent pas avoir un rendez-vous est interreliée à ça, mais on parle de 300-400 personnes, c'était plutôt qu'on n'avait pas le vaccin et qu'on ne pouvait pas ouvrir les appointements dans le système. Maintenant, on semble passer à une prochaine étape aujourd'hui et probablement dans les prochaines semaines. C'est pour ça qu'on rouvre plusieurs autres centres communautaires et les pharmacies aussi vont recevoir de façon significative d'autres vaccins. Donc, je pense que cette problématique-là, lorsqu'il règle, en tout cas pour moi, n'est pas vraiment actuellement, à part d'être prêt et d'analyser ce qui se passe, est vraiment un problème majeur qui va impacter de façon significative la communauté.
Mr. Eli on this? Do you want me to translate the question or?
Yeah, well, I got part of it and I got part of Tony's answer, but my understanding is a concern around the no-shows and what steps we're taking to address it, correct?
Yeah, exactly. And a little bit of the political reaction toward this. What are you telling your constituents in these circumstances that are taking a lot of, well, are booking more than they should take? Yeah, that they should.
Yeah, so I guess Tony spoke to this earlier, and we do have systems in place so that we're not wasting any doses. Either they're going to priority groups at the end of the day on a call-in basis, or we defrost and dilute them in batches that are manageable, so we don't have too much sitting around that can go bad. So I'm confident in those processes that there isn't any vaccine going to waste. In terms of the second piece, I also understand why people are sort of scrambling or have been over the last little while to try and get an appointment, at multiple pharmacies, and maybe trying to, with the city system or the provincial system as well. So, I would urge people to do everything they can to cancel an appointment if they get a second appointment earlier. As Tony said, the provincial system will do that, but there's a time lag. In a perfect world, that time lag would be much, much shorter so that people could take advantage of it. But I think the increased supply that we've been promised through Moderna and Pfizer over the next little while should take away the need for people to make multiple appointments. We're putting thousands of appointments into the system. People can move their appointments up. So again, try and book only once. If you book more than once, please do your best to cancel what you've booked, so to free it up for somebody else.
Thank you. Mon follow-up, c'est pour M. Desmonté concernant les 5 nouveaux sites. Est-ce que vous pouvez nous dire peut-être sur le portrait général de la campagne de vaccination que vous aviez établie il y a déjà plusieurs mois? Est-ce qu'on est dans les échéanciers que vous aviez ciblés, et aussi peut-être nous expliquer les ententes que vous avez avec ces endroits-là? Par exemple, le Centre canadien Tire, c'est du domaine privé et d'autres endroits aussi. Peut-être aller dans le détail un peu de comment vous avez négocié ces ententes-là avec ces parties-là.
En fait, OK, 2 éléments dans votre question. La première, c'est que en termes d'échéanciers, nos échéanciers, comme on a toujours dit, lorsqu'il y a assez de vaccins, on est en mesure, nos opérations sont prêtes. On est prêt depuis le plan initial au mois de décembre de l'année passée. On avait cette capacité-là prêt à répondre à la fois au niveau des centres, à la fois au niveau de ressources humaines, mais ça dépendait évidemment du nombre de vaccins qu'on avait. Et maintenant, on semble arriver à ce point-là qu'on peut ouvrir d'autres. Donc, c'est super positif à cet égard-là. Vous vous rappelez aussi les sites qu'on avait identifiés. La grande majorité sont encore là, mais il y a eu de l'ajustement parce qu'on a des sites maintenant qu'on rouvre, qu'on n'avait pas nécessairement planifié initialement. Parce qu'on est sur le terrain, on voit les endroits où ça fonctionne bien, et il y a d'autres partenaires, comme vous parlez du Centre canadien Tire. C'est dommage, mais nos sénateurs n'ont pas fait la coupe. Donc, initialement, au mois de décembre l'année passée, il n'était pas dans nos processus parce qu'on espérait qu'il soit dans la course pour la coupe cette année, mais lorsqu'ils ne sont pas, maintenant, ce site-là devient disponible. Et géographiquement et en termes d'opération, ce site-là devient très apprécié et très à propos pour un centre de vaccination massive. La même chose avec l'Université d'Ottawa. On retourne les écoles, on ne retourne pas aux écoles, etc. Donc, initialement, tu n'es pas nécessairement disponible pour nous au mois de décembre, au mois de janvier. Maintenant, c'est clair que ça devient disponible, et encore, c'est un autre centre. Donc, c'est pour ça qu'on a fait des petits ajustements. Par rapport aux ententes, la grande majorité de ces gens-là sont manifestés pour dire qu'ils étaient disponibles. Je t'avoue, dans l'équipe, c'est pas moi qui ai finalisé les ententes, Donc, si vous allez me poser une question en termes de coûts, en termes de ce qu'on... tout ça, j'ai pas ce détail-là avec moi pour l'instant, mais je peux vous dire que l'ensemble de ces gens-là ont immédiatement, parce qu'on parle de Centre canadien Tire et l'Université d'Ottawa, qui n'est pas des centres municipaux, ont été très, très prêts à supporter la campagne de vaccination et immédiatement nous ont donné une ouverture rapide afin qu'on transmet ces centres-là dans des centres massifs.
Merci beaucoup.
Merci. This brings us to the end of today's questions. Cela conclut nos questions d'aujourd'hui. Thank you very much. Merci.